Hemorrhoids causes, symptoms, and treatment. It's not a question that can be answered in a few seconds, which is why we've made this video. If I had to put hemorrhoid causes into one word, I would say lifestyle. Here are the most common causes of hemorrhoids. Number 1 on the list has to be straining during bowel motions. This causes hemorrhoids to swell and bleed and stretches the sphincter muscle. The biggest problem that causes you to strain is constipation. Hemorrhoids hate constipation. To stop yourself getting constipated, drink more water. This keeps you hydrated and keeps stools soft. Eat more fiber to help food pass through your digestive system easier. Exercise more. This improves blood flow and helps promote normal bowel movements. The next cause of hemorrhoid problems is sitting or standing too long. This puts pressure on the abdominal area and lower rectal area, causing hemorrhoids to swell. Are you overweight? If so, you are more prone to hemorrhoids. Overweight people are putting pressure on the blood vessels near the anus and colon. They also tend to eat the wrong types of food, and less foods containing fiber. Next. People who are prone to hemorrhoids should avoid lifting heavy weights. I'm talking about lifting anything that is heavy, because such activity causes straining, as well as bearing down, which can make hemorrhoids worse. Lifting heavy weights is very similar to straining when going to the toilet, as it puts pressure on the rectal muscles. A particular hemorrhoid cause for women is hemorrhoids during pregnancy. For two reasons. Firstly, the weight of the baby puts pressure on veins in the pelvic area, as well as the inferior vena cava. Secondly, women when pregnant seem to get more constipated. Another cause of hemorrhoid problems is taking opiates such as codeine for pain. They slow down the passage of food through the digestive system, which in turn results once again in the dreaded constipation. If you have pain, try taking paracetamol instead. Drinking alcohol or anything with caffeine is bad for hemorrhoids. Alcohol affects hemorrhoids indirectly by raising your blood pressure, and this puts strain on your blood vessels. It also causes problems with bowel movements because alcohol is a diuretic and causes dehydration. Once again, dehydration leads to the dreaded constipation, making you strain when going to the toilet. Caffeine drinks such as coffee or tea can cause what is known as dry stools and makes hemorrhoids worse. Caffeine also causes dehydration and irritates the stomach lining. And like many of the previous things mentioned, can cause constipation. Getting older can also be a problem for hemorrhoids. Mainly, this is because older people tend to have a more sedentary lifestyle, with little exercise, so often suffer with constipation. Those are the main causes of hemorrhoids. Here are the main hemorrhoid symptoms to look out for. The first symptom of hemorrhoids is often extreme anal itching. You often get the itch-scratch-itch situation, where you scratch it and it feels much better, but a few seconds later it is itching worse than ever. If you have an external hemorrhoid, this will show as a hard lump near the anus, which will often be painful or itchy. Hemorrhoids can also lead to bowel incontinence. The anal sphincter muscles do not work as they should. The rectal muscles can get weaker and stretch, and watery stools may then leak out. The next symptom you will probably experience is painful bowel movements. Although going to the toilet hurts, it will very often feel easier right afterwards, only to become painful again in a fairly short time. Especially with internal hemorrhoids, you could well experience blood. People with internal hemorrhoids can often experience blood on the toilet paper or in stools. Interior hemorrhoids are rarely painful. The first sign is normally bright red blood. The next thing I have to say is important. If you see any blood on toilet paper or in the pan, always get it checked by a doctor. It's very likely to be from hemorrhoids, but you need to rule out anything more serious. Probably some of the worst symptoms you can get are from a thrombosed hemorrhoid. If blood pools up in an external hemorrhoid, it forms a clot or a thrombus. This will be very painful. You will feel a hard lump that will probably be inflamed. Finally, a prolapsed hemorrhoid will cause you a nasty symptom in the form of pain. The way these occur is if you strain when going to the toilet, you may push an internal hemorrhoid out, and you will find it pretty painful. Okay, that's dealt with the symptoms. Let's move on to the various treatments. I am only going to discuss these briefly here, as we have several other videos which go into the treatments in a lot more detail. I have had experience with treating hemorrhoids for many years, and my findings may surprise you, but I can only speak as I find. Let's start off with the one everyone tries. Over-the-counter hemorrhoid cream. Our experience of these has been that they help a bit temporarily, as many have some form of local anesthetic. Also, the ones containing hydrocortisone seem to work better. I have however not found them to be a hemorrhoid cure. The next thing people try for their piles are hemorrhoid suppositories. Most people hate these. As with creams, they only bring temporary relief, they are very messy to use, and uncomfortable to insert. There are a few more successful hemorrhoid remedies, starting with hemorrhoid banding. The doctor puts a very tight elastic band around the hemorrhoid, which cuts off the blood supply. It should then drop off in about 10 days, and you should be able to return to work in about 3 days, after the operation. You can expect some pain afterwards, but paracetamol should help. Occasionally ulcers can occur at the operation site. Another reasonably successful treatment is sclerotherapy for hemorrhoids. This would not really be suitable for anyone who does not like needles. As this involves injecting a solution into the rectal blood vessels, this numbs the nerve endings, and eases pain. This is far slower than banding, and can take about 6 weeks for the hemorrhoid to get smaller. Don't get involved with any form of strenuous activity or sport for a few days after the treatment either. Electrocoagulation for hemorrhoids. This is not as shocking as it sounds. This is sometimes called electrotherapy. The surgeon firstly finds the hemorrhoid by inserting something called a proctoscope into the anus. He then places a metal probe at the base of the hemorrhoid, and a current is passed down the probe. It is a specialist job as the doctor has to work out the correct amount of current. What it actually does is thicken the blood going to the hemorrhoid, and make it shrink. This treatment is especially successful on smaller hemorrhoids. Full hemorrhoid surgery, better known as a hemorrhoidectomy, does work. It is basically a surgical procedure to remove hemorrhoids, and is normally done under a general anesthetic. The surgeon will gently open the anus and remove them. Whilst it is normally very successful, there can be a lot of pain, and in around 5% of cases they can return. What is quite painful also, is the cost. This surgery is quite expensive. Finally, I believe I may have kept the best for last. As I said, I have been discussing piles treatment with people for years. I have looked at most of the treatments available, and I now only recommend one. It is a low-cost, clinically proven, natural treatment program, developed over 12 years ago, and which to date has helped hundreds of thousands of people in over 120 different countries. I won't go into lots of detail about it, but if you would like to read more about it, there should be a link across the screen now. There's also a clickable link in the description below. By the way, I have a more comprehensive article, which goes into all of the above treatments in far greater detail. I have also put a link to that in the description below. I wish you well in your battle with hemorrhoids.